So what do you think is the best way to ensure that Americans have healthcare and why?
So I think that, first of all, that it is a disgrace that the wealthiest country in the world has tens of millions of people who don't have adequate healthcare insurance or adequate access to quality healthcare. Personally, I don't think that this is an economic issue. I think this is a moral issue. Everyone in the United States should have access to high quality healthcare. The question, of course, is how we do that. I believe that the government should ensure that anyone can get access to high quality healthcare, whether they can afford it or not. I'm a believer and a supporter of a public option to make that available to everyone. I do not believe that we should take away private insurance from people who like their insurance, but we should absolutely make sure that everyone has access to high quality healthcare and that we enable Medicare to negotiate separately around drug prices that will serve everyone well.
So first of all, we need to make sure that all Americans have universal access to high quality, affordable health care. That includes all undocumented immigrants, because we have seen when one person doesn't have health care, it puts them and everyone else in danger. So I think we need to immediately strengthen the ACA, add a public option, and expand Medicare from 65 to 50. I think that is the smartest thing we can do right now, because if you were to move on to Medicare for all immediately, it's going to take a ton of time to get there. We don't have the votes politically right now. I wish we have already flipped the Senate, and I hope we do in this election, but we need at least 60 votes in order for that to happen. And we have to understand the costs and consequences of a Medicare for all. And that's going to take a little time, especially in Massachusetts, where 98% are already under healthcare coverage, but it's really expensive. And we have a life science industry that's a driver of the economy. We need to understand, if we do get to a Medicare for all, what are the consequences to that? Finally, the first two things I would do if I was a member of Congress is, one, pass paid family and medical leave. We can't be the only industrialized country in the entire world not to have paid family and medical leave. I have 4 young kids, and my wife worked for the federal government for 2 of those kids and didn't get 1 day of paid leave off. And the second thing I would do right away is make sure that the government can negotiate prescription drug prices for under Medicare. We are the largest purchaser of prescription drug prices, and we need to be able to leverage that position, and we can't right now.
You know, as someone who have lost my father when I was 13 because we couldn't afford his healthcare needs, I have dearly held healthcare as a human right in my heart, and I have been a huge advocate for universal healthcare, single payer. I am a huge supporter of Medicare for all. I have successfully pushed our current Congressman Joe Kennedy to add his name on Medicare for all, and I wanted to see more from our district. I wanted to see leadership that leads on such issues and making sure that we are centering racial justice and centering social justice in the work of providing healthcare to everyone. Medicare for All provides, hearing. It's the expanded and improved Medicare, where you have hearing aid, you have vision, you have dental, you have mental health, you have long-term care. All these things are provided and accounted for, and you have a negotiator on your behalf of medication, so that people would no longer need to ration their insulin or other medication like my father had to go through. And so, to me, Medicare for All is a necessity, especially now in the face of COVID-19, where we're only safe as the least insured person of us, and that means everyone should have health care.
I support universal health care in the long run. Short term, I would like to see immediately a single payer option for the ACA simply because it could get implemented as quickly as possible. And implementing complete healthcare reform is going to take a long time because people are basically afraid of it. If you start to mess around with people's healthcare, they freak out. I mean, we saw that twice now. With the ACA, people were opposed to it for about 6 years. We lost Congress. And Republicans tried to reform healthcare. They lost Congress. You can't do it quickly. You have to give people time.
I believe that healthcare is a human right and should be guaranteed for everyone. And over the past few years, have seen firsthand how much is wrong with our current system as my own parents try to navigate our incredibly fragmented and costly healthcare system to obtain the very expensive medications that my mom needs to treat a rare autoimmune condition that she's been battling over the last 4 years. I support moving in the direction of Medicare for all. I would begin with creating a public option. And my underlying value here is to get as many people covered in a quality and affordable way as quickly as possible. And to my mind, starting with a public option is the best and fastest way to do that. I also support allowing the federal government to negotiate drug prices, capping out-of-pocket costs on prescription drugs, and enabling the importation of safe, vetted prescription drugs from countries like Canada.
Yeah, it's a big question. And, I think, look at what's happened over the past couple months. Tens of millions of Americans have lost their jobs. That's been the case in lots of countries. What's different about ours is that also meant that tens of millions of Americans lost their health care. And that's not the case in a lot of other countries. Again, back to Elizabeth Warren. This was one of the reasons that I endorsed Elizabeth Warren. She had a plan. Her Medicare for All plan would have gotten health care to every single American in a way that I thought would have been affordable and ensured quality got to them. But let's just take a step back. I mean, I think the answer here is we are for health care for every single American, right? That's what we stand for as a party, and that's what we're all working toward. And I say that because I think it's important to remember, what is the other side's plan exactly to provide health care to Americans? What is the other side's proposal here? They don't have one. And I think that what I've seen in my career is that there are lots of paths to this shared goal. So Elizabeth Warren had one that I thought made a lot of sense. But when I was in Governor Patrick's office in the State House, Massachusetts was the first state with a universal health coverage plan. When I was in the White House in the Obama administration, that was when we were expanding the Affordable Care Act to 26 million Americans. And so, I think that what we have to do is continue to make this case. And the way to do that is to not just, talk about the sort of the what's of what we want to do, because there's some people who don't like Medicare for All. There's some people who like another plan. What I saw in the White House is it matters how you talk about this work. And, I was thrilled to have John Favreau's endorsement from Pod Save America, a wonderful person. And, that this is a point that he makes all the time. When you ask people, what do you think about the Obamacare? That, we would get these poll results in the White House, and I would see them. About 40% of people liked Obamacare. Then if you said, what do you think about the Affordable Care Act? Oh, now all of a sudden, 60% of Americans would say, oh, I don't like that Obamacare, but the Affordable Care Act, that's pretty good. And then if you said, well, okay, what do you think about people with pre-existing health conditions still being able to buy insurance? What do you think about, children being able to stay on their parents' insurance until they turn 26? All the pieces of the plan, well, all of a sudden, 85% approval. So I think the good news is that the majority of the country is with us. The majority of the country is aware of these heartbreaking stories that we're seeing now and we're seeing for years about people who would go bankrupt because of one diagnosis, even if they had insurance. I think the real question is, how do we mobilize that coalition to actually get more health care to more people?
I'm for Medicare for all who want it. I know this issue intricately. My mother was a nurse. My father was a doctor. My daughter, who will be going to Northeastern next fall, has had 2 open heart surgeries, emergency surgeries, one when she was born, the other when she was 13. So I understand this. I think we should have Medicare for all who want it. I think we should have a strong public option. I think that we need to build off of the Affordable Care Act. And again, I think because of the COVID-19 crisis, it's clear that healthcare has to be a right for everyone. And we can build the consensus to do that. The 150 million people have private health insurance. I don't think it makes sense to all of a sudden say, we're going to take you off that. I think we should have a strong public option, and then people can choose if they want that. And we should subsidize people who can't afford it so that they can buy into it. There are a lot of union members who fought hard and gave up income for their health care. I don't want to take that away from them. And I think if we do that, we can get to healthcare for all. We have to do that. It's really clear now.
Yeah. So, as I mentioned, I am currently on unemployment, which also means I'm part of Massachusetts' incredible healthcare system. I have to say it's by far the best healthcare I've had, and I've had plenty of healthcare from other institutions. And I also know that your listeners are going to be getting to the age of 26 soon, and they're going to be off their parents' healthcare system. And so, in addition to the enormous college debt that you're going to have, and the enormous house prices, you're also going to potentially, if your employer doesn't provide it, incredible healthcare costs. And so I would love to see the country be able to enjoy the healthcare that I'm currently enjoying, which is, look, the purpose, and I say this all the time, the purpose of government is not to make money. It's not to pass policies to help corporations perpetuate their wealth creation, though that's part of it. The purpose of government is to make sure Americans are flourishing and really thriving and succeeding in life. And I don't know how you do that unless you have good healthcare, unless you can actually be taken care of physically and emotionally. So I strongly support Medicare for all, single payer healthcare system, because not only, again, between the needs of the people and the needs of the economy, it's the only way that I can conceive that we can actually drive down prices by having one organization negotiate prices across the country.
Healthcare is a human right. It's not a job perk. And this issue is both personal as well as professional to me. I grew up in a healthcare family, mom, dad, sister, brothers, aunts, uncles. Almost everybody except for me was in the healthcare profession. I was the black sheep and joined the military after college instead. But what that means is that I understand how complicated this sector is, but I also understand the moral imperative and the service that is rendered by healthcare professionals, as we've seen in such high relief in the last 3 months. So I believe that the best way that we can ensure that every American has high quality, affordable healthcare, that those 30 million Americans who are being left behind are no longer left behind, is to build off the success that we've seen with the Affordable Care Act and to use Massachusetts, frankly, as a template for universal access. We've gotten pretty darn close here in this state. That means introducing a public option, fixing some of the reinsurance and premium hike challenges that have bedeviled the ACA and that Republicans, frankly, have refused to help fix. That means creating more transparency in drug pricing and aligning incentives better between the commercial sector and the public sector in terms of how drugs are scheduled. And that means better cooperation between the public sector and the commercial sector and insurance as well. I do not believe that we should be abolishing commercial insurance. It's an important source of competition and innovation that does keep prices lower than they might otherwise be in a federal single payer system. But we do need to ensure that we are working together at the population level, as we've seen with some success in Medicaid. So just to summarize there, I think healthcare is a human right. I think it should be universal and affordable. And I think building on the success of the ACA and using Massachusetts as a template nationwide is the best way to do that. That means a muscular public option with an individual mandate, as well as much better alignment of incentives and much more transparency in drug pricing.
So, as again, someone who works in public health, I know that health is not simply the absence of illness and disease, and health also is not simply about access to care. But at a bare minimum, access to quality care that is free is a fundamental human right. The fact that this is one of the wealthiest countries and spends the most among its peers in terms of healthcare, and yet has such bad outcomes. The fact that we see inequities in maternal mortality between Black and white moms or children and infants means that our healthcare system is broken. I think that we need to guarantee that nobody has to worry about not being able to get the same quality care because they can't afford it, nobody at a time of COVID should have to deal with this, but nobody at a time, anytime in our lives. So as someone committed to health and human rights, I feel strongly that our healthcare system is broken and we're going to have to radically change it.
Medicare for all. There's no question, as I talk to experts about the path we need to chart forward around healthcare, the thing that they tell me will help us, tackle affordability, tackle access, tackle prescription drug costs is Medicare for all. And when you look at what is happening in this crisis right now, over 30 million Americans have just lost their jobs in a system where your access to health insurance covered is tied to your employer. I mean, how could we not seize this moment to reevaluate what we're doing and think about a smarter path forward? I'm not blind to the political realities that will be necessary in Washington to make Medicare for all happen. And if I show up in DC in January of 2021 and we don't have a Medicare for all majority in the House, Senate, and certainly a different person in control of the White House, then we have a moral responsibility to address the very literal pain points that people are experiencing around healthcare and to strengthen the ACA. But I see that in service of a march toward Medicare for all. And my preference would be that we get there sooner rather than later. I've committed to joining the Single Payer Medicare for All caucus in Congress on day one.